Good afternoon. Welcome to Marketplace 5. I'm Jessica Taloni. Joining us today is Dr. Barry Ripps of NewLife Fertility Practice. And Dr. Ripps, we've been talking over these last few weeks about infertility. Today, we're talking about miscarriages. What is it that causes miscarriages?
You know, miscarriages are most commonly caused by an abnormal pregnancy, which means it has nothing to do with the mom or the hormones of the mother. It's the pregnancy itself. And as most women know, an occasional pregnancy loss is very common. Once in a while, it's very disappointing. For some women who've been trying to conceive for a long time, it's devastating. And if it's happening repetitively, it's heartbreaking. You know, consecutive pregnancy losses may be a sign that there's something else going on, another cause of that loss, in addition to occasional abnormal embryos or abnormal pregnancy.
So if it happens over and over again, is there a way for a woman to find out why she's having this problem?
We have a whole panel of tests that try to identify conditions or diseases that raise a woman's risk of having a miscarriage above that of just having an abnormal embryo. So these tests, when they're completed, usually identify a cause in about half of the couples. But for all the patients who are experiencing those recurrent pregnancy losses, the technology for identifying the healthy embryos is the best opportunity.
And most importantly, out of all of this, though, what can be done? If you find out what's wrong, what then can a woman do?
So now with the newer technologies, we're able to find those genetically normal embryos. Those genetically normal embryos come from genetically normal eggs. In a microscope, all the embryos look alike. But with the genetic testing, we're able to find the embryos that have the best chance of making a healthy pregnancy. You know, our practice was the first on the Gulf Coast to offer this genetic testing back in 2010, and it is amazing what we've been able to accomplish. In fact, we can reduce that chance of miscarriage from about 40% down to 3% if we transfer a healthy embryo.
And you've told us all along the key is to seeking help quickly, not delaying in that, and finding a specialist.
Right. The specialists have the technology that will help women conceive who have suffered recurrent pregnancy loss. It is usually an effect or a consequence of the woman's age or egg quality, and this is the best way to overcome that hurdle for fertility.
All right, if you'd like to reach Dr. Barry Ripps, you can find him on Facebook. Look for NewLife on Facebook. You can also check out their website. It's www.fertilityleaders.com. They've got an office in West Mobile as well as in Pensacola. Thanks so much for joining us, Dr. Ripps. For Marketplace 5, I'm Jessica Taloni.
New leaders in fertility and endocrinology. NewLife. Call our office right now for more information.